morning, everybody. We hope everybody can come and make their way to their seats for the auditorium. And I'd like to welcome everyone to Baltimore for this 5th Harm Study Group sponsored event called Power Over Scoliosis. I'd like to thank Johns Hopkins for giving us this space and sponsoring it, and all the providers. I'm Paul Sponseller, and the event co-chair is Kristen Venuti. Kristen, are you here? Kristen's been an amazing force behind the scenes and has provided tremendous insight, education, and advice for getting this started. And of course, it's been powered especially by Michelle Marks and her amazing organization through the Harm Study Group, the Setting Scoliosis Straight Foundation, that has made this possible. I'd like to ask everybody to please put their cell phones on silent or vibrate if you can. And also the rules for the institution, which are not always followed, are to hopefully not have any food or drink in this auditorium. So in the future, just kind of try to minimize that a little bit. Our organization is called the Setting Scoliosis Straight Foundation, which is really a development that's been 20 years in the making, part of the Harms Study Group, named after Jürgen Harms in Germany, which provides research into the better care and treatment of patients with spinal deformities worldwide. And this is made especially targeted toward families, which is you, patients and families, so that we can provide education and also get feedback from you as to what's working, what's not working, how to engage you in your care and make things better going in the future. And over the 20 years that we've been working, there have been major advances in how spinal deformity is cared for, both non-surgically and surgically, and this is just part of that evolution to make things better in the future. Our commitment is to patient education and to provide evidence-based information to try to combat some of the internet noise. Internet's good because you get information, but sometimes you get too much information, so these are resources to try to cross-check and try to find the right balance between that. And also to connect patients for collaboration and patient support, because it's always very valuable to have other people to talk to and relate to as you go through the journey of caring for spine deformities. The Harm Study Group and SSF have done measurable things in making care better. And one example is just the simple fact of how quickly people can get out of the hospital now. Just looking back to 2012, you could see that the average stay, this is real data from our database, was 6 days in the hospital for a spine fusion. And every single year it's gone down, and now it's down to an average of 3.3 days in the hospital. So that's just a simple metric, but there are other metrics in terms of the length of the surgery, the success of the surgery, the amount of blood loss, and also some non-surgical issues as well that have improved through collaboration and research to make things better. I'd also like to thank our sponsors, which you will have mostly met out in the lobby there, but they include Nuvasive, Green Sun Medical, DePuy Synthes, EOS Imaging, Medtronic, the National Scoliosis Center, and Globus. So we have had tremendous support in making this possible so that this can take place. And especially I'd like to thank our collaborators, the patient-centered organizations such as the National Scoliosis Foundation, the Marfan Foundation, which I'm part of, the Scheuermann's Disease Foundation, which is the first to promote awareness and efforts to improve Scheuermann's kyphosis, Curvy Girls, which is a patient-centered organization that's newer than some of the others. And then I'd like to thank the FDA for helping this cause and kind of surveying the situation, trying to maintain focus, maintain standards, maintain appropriateness, and studies going forward. And of course, Johns Hopkins, who is my boss. So the way this event is scheduled, we have 3 rooms and we have 3 periods. The first session is everybody together, and we'll provide an overview of all aspects of spine deformities, and that will be for an hour. And we will then break into topic-based groups. We have early onset and neuromuscular, which is next door, and then we have Scheuermann's kyphosis, which is just down the hall beyond that portrait. And then this will be the adolescent idiopathic scoliosis group. And we'll have 2 sessions for each of those groups. The first session will be people talking, providers, experts talking to patients about the disease, both non-surgical and surgical. And then the second session, which will be for an hour in each room, will be talking among ourselves, patients sharing their experiences and relating to each other, asking questions in a more informal setting. And this will go to noon, and we will then end at noon. There will be a sponsored lunch, which we'd like you all to stay for so that you can collaborate and share questions, meet each other, network, talk about best ways to go forward with this type of education for patients, and then we'll finish up just after lunch. Also like to forecast next year. We will have a great event sponsored by Drs. Lahner and Lenke, the Barry and Larry Show in New York City. It will be started with an evening, 26th of June in New York City to, again, have a gala and fundraiser, and then a patient-centered event on the 27th, Saturday. So hopefully you can attend that as well, and we will make it even better next year. So enjoy the day. Our goal is really to provide you evidence-based information to help the scoliosis journey be more successful, and also consider helping us to help others in the future. And if you wish to help support this research and support scoliosis care, you can donate by texting help back to 41444 and make a donation at any time. So with no further ado, I'd like to proceed with the morning's program. And we are very honored to have a patient, Emma Arruda, who's also a supermodel and scoliosis spokesperson, who's going to be talking about her perspective and journey in the scoliosis world. Thank you.
Thanks. You're welcome. Hi everyone. So I just have like a short little clip that I'd like to share, kind of explaining my story first before I go on to the before and after. So here it is.
Walking the catwalk for one of the biggest fashion houses in the world, Dior. Something this team can't believe is happening, just 6 months after launching her career. And having been born with scoliosis and a pronounced S-curve in her back, it's a dream she didn't think would ever come true.
I kind of just wanted to hide it all the time. And obviously I was in pain too, so just, I don't know, it wasn't a good situation.
2 years ago, Arruda had major surgery called spinal fusion. Her back was straightened using titanium rods and screws. But this modeling scout didn't even know about it when she signed her.
She had an incredible posture, and I figured out later why, because of her scoliosis, and is not slouching. She's the straighter person you've ever seen. So,
Titanium.
yeah, it's incredible. She's like a bionic woman.
Arruda walked in Toronto and New York fashion weeks this summer, and now Paris. That's where we caught up with her, in between fittings and casting calls.
When I thought of it, when I started modeling, I didn't want to tell people because I thought it was like a bad thing. I'm like, oh, if no one like sees my scar or asks about why I do certain things, but then I realized like it actually is a good thing. It is inspiring to other people and it can help other people.
After she posted before and after photos of her surgery on Instagram, she received thousands of messages, many from teens with scoliosis and others who were just inspired by her story.
You may not think that something is possible, like you might put yourself down or doubt yourself, but like you can overcome anything if you actually believe that you can.
And her agent says in a very tough business, enduring the pain that she's had to from surgery and a long recovery has prepared Arruda for the demanding career that lies ahead. Phil Bridget on CBC News, Toronto.
Okay, so thank you guys for watching. So when I was 14 years old, I was diagnosed. I'm 19 years old now. I waited 6 months. I was put on a waiting list. I'm from Toronto, so I did my surgery at Sick Kids Hospital in Toronto, and they were just incredible. I'm really thankful for the doctors there. They took really amazing care of me. So when I was diagnosed, I had 2 curves. One was 49 degrees and one was 66 degrees. So when we found it, it was already kind of drastic when we had discovered it, so it was a little bit too late for me to wear a brace, so surgery was my immediate option. Since I had to wait 6 months, my doctors had suggested just sort of like maintenance for the pain, or pain relief in the meantime. So I did lots of swimming helped, I did stretching. My mom and I signed up for yoga classes. I felt that really helped, so just for some tips. I remember it being really hard in school, you know, to carry a heavy backpack, your books all day. It puts sort of strain on your spine, even just to sit in the chairs that are sturdy all day. So those were kind of some day-to-day struggles. I remember my ribs were completely turned, so it would squish my lungs. My hips were sort of off balance. So I remember my parents were like, why do you walk so funny? Why do you sit so funny? You know, we never really noticed the warning signs just because, I don't know, it just grew so gradually. We didn't quite notice at the time. And then when we were diagnosed, we were like, okay, this is all making sense now. I was fused from T2 to T12, so it's quite a lengthy fusion I had done. I have 2 titanium rods and 19 screws. After surgery, I was really looking forward to the surgery. Just from being in day-to-day pain, I remember the day of my surgery, I was so excited. My mom was freaking out, and I was like, honestly, I just can't wait to get this over with. I just want to be out of pain. But I have to say, after the surgery, it was a very lengthy recovery. It was super painful. I was in the hospital for 5 days, I believe, afterwards, and I needed help for about 6 months before I could start doing things on my own. My mom, thank you so much to my mom. She was super helpful. Like, I needed help with everything. I couldn't shower by myself. Just to lay in bed like this, to turn over like that, you need someone to come and, you know, prop you up. I would suggest I got a body pillow. It's super helpful just to kind of, you know, lean yourself, whether it's in a chair, in your bed, whatever. Also in school, I had a friend that was really helpful. I couldn't carry a backpack afterwards for surgery, so I got like a little rolling bag, or my friend would carry my books, which was super helpful. I experienced some numbness because of the nerve damage in you know, the way that they cut the spine, but it came back after a couple of years. I remember my friend would touch my back and I just couldn't feel a thing, but now it's all coming back. So in the end, I think now I feel 100%. I move differently, but it's what feels comfortable to me. You know, I can't bend my back over into like a C shape, but you know, now I feel comfortable and more myself. So I think in the end, it was really worth it. I think the technology is incredible. I think that's why stuff like this is so important. You know, we can all share our stories and see what helps with certain things, you know. And I think we've come a long way, and I'm really grateful for how everything turned out. So thank you guys so much, and if you guys have any questions at the end, I'm looking forward to talking to you and answering any of those. Thank you.
Thanks for sharing that and being a spokesperson, and also highlighting last night, Em. That was great. Any questions for Em that people would like to raise right now? Or you can catch her. She's not hard to find throughout the morning. Next, I'd like to introduce, to those who don't know, Peter Newton, who is current president of the Scoliosis Research Society, as well as head of the Setting Scoliosis Straight Foundation. Peter is one of the world experts in spinal deformity of all kinds, an amazing thinker, and he's going to talk to us about what is spinal deformity and how frequently does it happen.
Great. Well, thank you, Paul. And Em, thanks again for starting our program this morning. I just want to start with the basics of what is scoliosis and how often does it happen as we just introduce this topic. I think most of you have some sense of scoliosis. You wouldn't have signed up for an event like this if you didn't have some idea. But just to bring us to the same place, the spine anatomy is such that we have 3 regions of the spine: the cervical spine, the thoracic spine, and the lumbar spine, made up of vertebra that you see here. And that multi-segmented column normally maintains an alignment as we see in this image. But it's actually a very unstable construct if you just sort of think of it as from an engineering standpoint. If you build all these blocks and leave them flexible and expect them to stand up straight, it takes a lot of superstructure and control of the muscles and the neurologic system to keep that in its proper alignment. And when things go bad, the spine turns and begins to buckle. And if we look at the spine in 3 dimensions, we also realize that this is more than just a simple curvature in the frontal plane. So there's some other deformity that's going on that's not always so obvious when we look just at a plain x-ray. So these three-dimensional reconstructions that we can obtain now from several different technologies allow us to understand that scoliosis comes in all sorts of varieties and shapes and also causes. So some of you will be interested in or have adolescent idiopathic scoliosis, the type of scoliosis that we don't really understand the cause of. One of the big focuses of what we do within the harm study group and in Setting Scoliosis Straight is to try to get to these causes, not just the treatment. Scoliosis affects the shape of the body, and this is how we notice it in the beginning. We don't have x-ray vision, so when we see our patients and you see each other, you're looking and noticing these shape changes in the body. And it can present as changes in the height of the shoulders. It can present as changes in the position of the shoulder blades as it sits on the chest. And you may notice some asymmetry in the waist. These are all features of and signs that scoliosis may exist in a given patient. So the other thing that many of you appreciate with scoliosis is this change in the ribs. And as the spine moves, it moves the ribs with the spine. And the ribs that attach to the spine take on a new shape. And that shape of the rib is noticed when you do this forward bend test, which is the common screening test for scoliosis, is to bend patients over and look for that high side, which signifies both rotation of the spine, but also change in shape of the ribs. And it's also important that the ribs form the chest, and inside the chest are some very important bodily functions and organs. The lungs are there, obviously, to provide space and oxygen exchange for breathing. And the heart lives inside that, and that's the organ that pumps this oxygenated blood to the rest of our body. So in small degrees of scoliosis, these two organs do just fine. But in severe forms of scoliosis, there can be an effect on heart and lung function, which I think we all understand is important for us to breathe and do well. The adolescent idiopathic form of this condition is very common. So 3% of the population of healthy teens have some form of this scoliosis. Most of them, fortunately, are mild, but some will be severe. So if you just think about, not this room, because this room is sort of specially selected for people with scoliosis, but in a room of this size, typically, there will be several people who have scoliosis. In every place that you walk around in all of your walks of life. So it's a really common condition. Fortunately, as I said, most of those are mild cases, but still not so uncommon in more severe forms, which will require some form of treatment, either with a brace or some way to manage the curve from progressing, and then also potentially surgery. Scoliosis in other conditions have much more variable rates. And if we look at different conditions such as cerebral palsy or neurofibromatosis or the congenital forms of scoliosis, the rates are quite variable and really dependent on the underlying condition that is associated with scoliosis. So I hope that introduction will just allow us to kind of set the baseline of what we're talking about today. And enjoy the day. Please feel like this is going to be an interactive session where we can converse amongst each other at all points of this program. And we'll stop right there. Thanks very much.
Thanks, Peter. That was great. We really have people from all over the country. Peter came from San Diego, and we next have Josh Pahys, who's from Philadelphia. He's an expert in pediatric orthopedics, and he'll be talking to us on the next step in your diagnosis, follow-up appointments, and what to expect. Josh, thank you.
All right, so I'd like to thank Dr. Sponseller and Michelle for having me here. we'll get started. Welcome. So you have scoliosis, right? You got diagnosed, and if you're just like me and was pulled out of line at your middle school screening, or if you're a pediatrician, found a rib asymmetry on your annual exam, you have scoliosis. And then so someone tells you have a hump. Oh my God. So what's your first thing you do? Well, you go to the internet like everybody else, right? You want to find out, one, it's very common. So it's not as uncommon as you think. Look around the room, you're in good company, right? And this is what I thought was kind of funny, is the first thing that came up is, can scoliosis kill you? No, it won't. So take a deep breath, you're going to do fine. But just know, you're in good company, right? You already met a supermodel this morning. You could be one of the best cellists in the world. You could be the fastest swimmer in the world. You could be the fastest man on the planet. You could be a princess from the UK. Or you could be a pale, lanky spine surgeon from Philadelphia. So now you got to go see a specialist, right? And if you don't have one, or if your pediatrician doesn't recommend one, you can always go to the Scoliosis Research Society's website. It says find a specialist at the top. You can type in your address, and you can find a local surgeon in your area that's a specialist in spinal deformity. So then you go to your visit, which can be kind of daunting, but I promise it's not as bad as you think. They're just going to go over your history, do an exam, and then come up with a plan for treatment. First thing you do when you come in, they just go over your medical history, very easy. When was it first detected? Do you have any family history? Anybody in your family have scoliosis? Any neurologic symptoms? Back pain if you're a female? When was your first menstrual cycle? And then we're going to do a neurologic exam, among others. And people always ask, why does the doctor ask me to wiggle my toes? I'm here for a problem with my back. What we want to try to do is figure out, are there any reasons you have scoliosis? Is it just idiopathic scoliosis, which is the majority of patients out there? Or is there some other underlying cause that we might be able to pick up before it becomes a problem? So we'll test your muscle strength, we'll test sensation, and reflexes. It's all general examination. Then, as Dr. Newton was talking about, we'll look at shoulder balance. Some kids with scoliosis often can have asymmetric shoulders. Then we'll look for a trunk shift. Some kids, just like me, will have a bit of a trunk shift from one side to the other. People will say your hip sticks out. It really doesn't, or leg lengths are too long on one side or the other. Usually it's not. It's just because as the spine shifts and rotates, one side can stick out a little bit more than the other. Then there's the classic Adams forward bend test. This is how the screening process that goes through. And once my patients have been coming to us for a long time, they usually just kind of come in, they give me a high five, and they turn around and bend over, which is a little awkward, but they sort of know the drill. But this is what we're looking for, is just as the spine shifts and rotates, looking for sort of the degree of asymmetry, or the magnitude of the curvature. And this is just sort of a general screening process that we can do. And it's a very old school technique, but it's tried and true over the long period of time. We just put basically a level on your back and figure out just how asymmetric your back is, which can give us an idea and help devise a treatment plan. And then from there, it's usually off to the x-ray to look for things. Then we're going to assess the curve, the size, and the location of it. And just know that, too, if you come back or if you see one practitioner or another, if the measurements are off by a few degrees, don't worry. That doesn't mean your curve progressed. People often come in and say, oh, this doctor measured it 2 degrees more than 2 degrees less. It's getting bigger. Take a deep breath. There's about a 5-degree measurement error. Even if I measure the same x-ray myself the next day, we can be off by a few degrees. It's just human error. So whether it's a small curve, a larger curve, or a really big curve, we're going to help devise a treatment plan. And then as Dr. Newton touched on, your skeletal maturity is a big deal. We're trying to figure out, because that gives us a sign of what's the risk of progression, or how are we going to manage this. And so looking for skeletal maturity, as you guys probably know, is those patients that are in their growth spurt, they have a higher risk for progression. Those that are out or more skeletally mature, they have a less of a risk for progression. So we're going to look at your hips. There's something called the Rister sign that you hear about. It's just basically this little stripe that goes around your pelvis. And the longer that stripe is, the more mature you likely are, and the less growth you have left, and potentially the less risk for progression. Some surgeons, or if we're trying to get a little bit better idea of your skeletal maturity, will get a hand film with the Sanders digital score, and that's just looking at your the growth plates in your fingers, and as they close from the fingertips down to your wrist, gives a little bit better idea of where you are in your growth, how much growth you have left, and gives us a good idea of how we're going to predict for any potential progression. If you're lucky, if you go to one of the bigger centers, they might have an EOS machine. Everybody's always cognitive of radiation exposure, kids coming back and forth to get x-ray after x-ray, and that is cumulative. So thankfully, there's been some excellent technology that Dr. Newton touched on briefly, but with this slot scanning, it can take 2 x-rays at once, but it offers, more importantly, a 5 to 50-fold reduction in your radiation exposure compared to traditional x-rays. They have these sort of microdose filters that are on them now, so it offers a very clear picture, but much less radiation, which is important. So then what's next? Again, your doctor's going to evaluate all these things and put them together. It's your gender, your age, your clinical examination. Did we pick up any abnormalities there? Do you need to get an MRI? Usually not right away. Are you skeletally mature? Do you have a lot of growth left or not? How big is the curve and where it is? And then come up with a plan, because it can go in a number of different directions. So this can seem very daunting, be very nerve-wracking, getting pulled a bunch of different ways, but if you just take a deep breath, talk to your physician, the path to success can actually be quite straight. Typically, as long as your curve is fairly mild, you can just monitor with repeat x-rays in 4 to 6 months. Any sort of back pain, physical therapy is not a bad idea. Some folks will talk about exercise for scoliosis, and then we'll talk about bracing and surgery later as well. But it's important to build a relationship with your physician. This may be a long road with him or her, so a good trusting relationship is always important. As you may find out, many of us are parents, and I think we all treat our patients just like they're our own kids. And some, if you're lucky enough, will get Dr. Larson. She's actually the Mother of the Year. It's this amazing plaque that she got. I was very impressed. So I'm still going for that. And then you want to educate yourself. I'll just go over this very briefly, but some other websites are out there. There's a million of them, some good, some bad, and some ugly. But I think it's best to start out with some that have been vetted and sort of looked at by some folks in the community. Scoliosisresearch.org is an excellent website. I'm working actively on improving it. Setting Scoliosis Straight.org has some good patient and parent information on there for you guys that's trusted and has been vetted. Kidshealth.org is another excellent website. It's one of the most viewed sites on the web for information on health. It's put out there by pediatricians and medical experts. Scoliosis.org is a great source. It has both physician and non-physician members, and it's there to provide a number of resources for patients and parents. CurvyGirls.com, I think, is excellent. It's a network, nationwide, I think actually international network of peer-led support groups for folks with scoliosis, and I like their slogan of "We've got your back." It's been around for a long time, and I said it's been a really great resource, as you can know you're not alone with your condition. So I encourage you, if you are going to go online and start researching things, just be careful. Websites that are reviewed or approved by physicians is usually the best place to start, because I know there's a lot of stuff out there on Google. There's no website can take the place of an in-person visit with a physician. Any information you read should be discussed with your doctor before you make any decisions. And if it sounds too good to be true, just buyer beware, okay? But I encourage you all to embrace your curve. You're going to do great. And thank you for your time.
That was great. Thank you, Josh. That was great information. We should put all those resources on our website so those can be archived. It's really practical. We're going to save the questions for the end so we have the right amount of time to allot to that and stay on time for the rest of the presentation. Next, I'd like to introduce Bridget Gibbons, who's a master's level psychologist at Kennedy Krieger, who helps a lot of people deal with medical issues and orthopedic issues. Kennedy Krieger is our sister-affiliated institute dealing with neurological disorders right next door to Johns Hopkins. And Bridget will talk to us about scoliosis and life impact, compliance, and coping mechanisms. Thank you, Bridget.
Good morning, everybody. Oops. So the first thing that I really want to say is you're going to hear from a lot of speakers today who are really experts in their field. But when it comes to things like coping with scoliosis or its impact on your life, you all of you young people, all of you people in the audience who have scoliosis, you're the ones who are the experts. I'm not the expert here. What I'd like to do today is really share with you some things that I've learned from working with other young people with scoliosis and other health conditions about things that have helped them cope or really help them adhere to the medical recommendations that their medical teams have provided for them. So first off, what is adherence? Is it just following the rules? We think about adherence, we think about following the medical plan that your providers have come up for you. So some examples are things like attending medical appointments, taking your medications, or following a prescribed bracing schedule. So how is this different from compliance? So in psychology, we use the word adherence a lot, because when you think of compliance, if someone says I'm being non-compliant, it sounds a little judgmental. It sounds like I'm being accused of maybe being uncooperative or being defiant. And when we think about adherence, we really know that this is hard to do. It's not that you don't want to do it, it's that it's hard. So what do we do? The first step is sort of identifying what are the barriers to adherence. Sometimes it's as simple as just adjusting to a new routine. This is a new diagnosis. How does this fit into your life? You might have some pain and discomfort. You might say, wow, this brace is really hot at night, or it's itchy, it's uncomfortable. You might feel embarrassed. So the best way to really minimize these barriers is to be honest with your parents, with your providers, to figure out how do we problem solve to make these better? How can we lessen some of these things so that you can follow your medical plan? So what does it mean to be coping well with a diagnosis? Does that mean you're happy about it? Does that mean you think, woohoo, this is great? Not necessarily. I think it's pretty normal to feel frustrated and to feel upset and to feel scared at first. Managing a chronic health condition like scoliosis can impact your mood, and that's totally normal. That doesn't mean there's anything wrong with you if you feel frustrated by it. So coping and adherence go together because of something called the mind-body connection. So basically what that means is our physical health is impacted by our mental health. So for example, let's say I have a fear of public speaking. So my heart might be racing. I might be queasy standing up here, right? Because our minds and our bodies work together. And you might be thinking, but I have this new diagnosis, or I have this new bracing regimen to follow. How is positive coping supposed to help me? That's easier said than done, right? So what do we do? I think first off, acknowledging that it's okay to feel angry and frustrated. You might think things like, why is this happening to me? This isn't fair. My friends don't have to deal with this. The important thing to remember and to tell yourself is that scoliosis is part of who you are, but it doesn't define who you are. You all have unique characteristics about yourselves and interests that have nothing to do with scoliosis. It's really important to identify that support system, family, friends, peer allies who might have other health conditions who can support you, and attending events like this. So systematic desensitization is a strategy that can be really helpful, and it's really a fancy way of saying, how do we break down your goals into smaller steps? And you do that with your medical team, with developing a bracing schedule that maybe works for you, starting with 4 hours and getting up to 23. The most important thing I want you to remember from this talk is to celebrate each time you reach your goal. So rather than saying, I'm not done, I can't celebrate until I reach my end goal, every step along the way, taking time to acknowledge that you've done it. So I want to talk about positive reinforcement, which is not bribery. Positive reinforcement are positive consequences for adhering to your regimen or meeting a goal. So for example, if you meet your bracing schedule all week, you might get a trip to the mall. And one of the things I want to really stress with caregivers in the room too is that what we've learned is that positive reinforcement is much more effective than punishment or negative consequences for not meeting a goal. So I've heard from parents, sometimes they're inclined to say, you know, you didn't meet your bracing goal last night, so I'm going to take your phone away. And you know what I think? I think that's a really bad plan, because I think it really backfires. It can create more conflict between parents and kids. It can really make the regimen and having scoliosis seem even more negative. So I think really focusing on positive ways to increase motivation. Relaxation strategies are another way that can really help, going back to that mind-body connection. So we don't have time to go into all of them, but one of the things I want to highlight is something called imagery, which you've probably all heard of. It's sort of going to your happy place, and that again can be easier said than done. So the way I like to do it and think about it is going through my 5 senses. So like Mickey Mouse here is at the beach. So if we want to go to the beach in our minds, how would we do that? So we'd say, all right, what do we see at the beach? Maybe we see the ocean. What do we hear? We hear seagulls. What do we feel? We feel the sand. You get the idea. But that really helps you focus on going to that happy place to be relaxed, and that can help with pain and it can help with stress. So I think all of the young people in the room are probably much more in tune with technology than I am, but there's some wonderful apps out there for coping, for relaxation. There's guided imagery scripts. There's interactive games for all kinds of young people with health concerns. So please check it out and find something that works for you. So when is it time to say, you know, I think I need a little bit more help? I think if you're having continued concerns coping or adhering with your medical plan, then it might be time to get some extra support. And there's no shame or judgment there. The goal of working with a therapist would be to learn some strategies to optimize your health and your coping. That's it. Thank you.
Thank you, Bridget. That was great. And last in the session, I'd like to introduce Luke Stikeleather, who's a real pioneer and expert in scoliosis bracing. He has the National Scoliosis Center, and he's going to talk to us about bracing for all spinal deformity diagnoses. Luke, thank you. Thank you. And Luke is currently president of SOSORT, which is the international organization for non-op spine care.
Thank you very much. A pleasure to be here this morning. Michelle, let's come back for just a second, and let's see.
This is presentation mode right here, but I think your notes are going to go
Right. Oh, here it is. There we go. Okay. Here we go. Thank you. So we've already covered a number of things that I'm going to include in this, so I'll try to go through this pretty quickly. You're going to hear this repetition throughout the day, and it's good reinforcement, actually. We think of having scoliosis like any medical condition. It can be a real challenge. How we respond to the challenge can make all the difference. So when you've been diagnosed with scoliosis, what really matters most? I hope you received this booklet in your packet. It's a great reference from Setting Scoliosis Straight. It covers all the essentials that have already been discussed this morning, and I understand from Michelle it's now available on video as well. It tells you everything you need to know about navigating your journey. I'm pleased to have been involved in writing and editing the section on non-operative management, and I know there are several of you here with kyphosis and other types of spinal conditions. So I just want to acknowledge that while I'm largely speaking to the majority of those dealing with idiopathic scoliosis, I hope you will hear that these core concepts apply to all of us on our journey in life. Bracing for success starts with you. As Ms. Gibbons just said, your attitude and actions will have the biggest impact on your journey with scoliosis. Of the thousands of patients I fit with braces over 32 years, those with a positive attitude were more motivated and successful with bracing. As my patient Maisie says, I don't worry about what anyone else thinks. I'm doing my best even when it's difficult. Choose to become educated and knowledgeable. Dr. Pahys already spoke to that issue as well. Your power over scoliosis begins by asking questions. And there's lots of information, as he said, on the internet. Be very careful. Attempt to wisely discern fact from fiction. In the end, you want the best care for your condition because you want to be successful. In non-operative care, that's defined as preventing a curve from progression or not having surgery. So we want a team of specialists that's been mentioned as well. You need to build a winning team of players that include the physician, your parents, the peers, the orthotist, the therapist. It'd be great if we could have a psychologist as well. You want them to be knowledgeable and competent scoliosis experts. You will regularly meet with them and rely on them to guide and direct you with your program. Each one has a unique role and responsibility. Hopefully all of them are positive, passionate, and encouraging. There are a lot of braces out there in the world. Some are expertly designed and function very well, while others are made with the best of intentions, but unfortunately completely miss the mark. Most orthotists are generalists. They are not specialists. Remembering that all braces are not the same is very important. Very few orthotists have the depth and breadth of experience in treating scoliosis and spinal conditions. In the end, it's more about the competency of the orthotist than it is about the brace design. Your child's compliance is strongly influenced by the brace. The comfort and appearance are critical. They are much more likely to wear it when it fits well and looks good. With the help of your professional team, you'll develop that right treatment plan that's already been mentioned, that addresses your specific needs and issues. This plan will give you all the details about brace wearing time, follow-up appointments, x-rays, physical therapy, and weaning from the brace. Your role and responsibility is to follow the plan as best you can. Be diligent wearing your brace. The number of hours definitely makes a difference. Several new studies confirm the findings of the brace study showing that patients who wear the brace more hours tend to have the best results. While the primary goal is to keep your spine stable and prevent progression, an increasing number of our patients are getting long-term improvement. That's a little controversial, actually. When they have active growth, faithfully wear their brace at least 21 hours a day, regularly see their treatment team, and diligently follow the plan, it's an achievable goal. In addition to the positive coaching and encouragement from your orthotist, therapist, nurse, and physician, patients who share their experience with family and friends stay on course with less complications and emotional stress. There are a number of good support groups that have already been mentioned, like the National Scoliosis Foundation and Curvy Girls. Get involved. Follow some of the advice of our patients. Throw a party. Invite all your friends over. Let them try on the brace. Celebrate this new phase in your life. Seek some of the older patients who've already been down this path. Ask them for their advice. As a quick review, while success is never a guarantee, is much more likely if you invest time and effort becoming knowledgeable, work to have a positive attitude and realistic expectations, and seek the experts, building a team of scoliosis specialists that help you develop your individual treatment plan. Additionally, find the most competent orthotist who provides the best brace design and diligently follow your treatment plan with that. Remember, you're never alone on this journey. While your scoliosis will always be part of your life, it does not define you. It's not your identity. So embrace the challenge. It will make you stronger, and you will be successful. Thank you very much.
That was great, Luke. So we still have about 10 minutes left for questions from the audience before we have to break. And we can ask any of the speakers this morning questions that come to mind. I guess I'd first like to start out with Bridget for a quick question. Oftentimes it's hard to start and continue with bracing, and we know that you're interested in this, Bridget, but how does one find in the individual community, where's the best place to seek advice when you're having trouble starting or maintaining your brace goals?
That's a great question. Can you hear me? I think being proactive about it. So I think in the beginning, if you're having trouble, at that point, try to seek support. I think I would start definitely with your medical team and go to them and see if there's a specialist that works in your team also to help.
Bridget, can you articulate for us what are the most common fears that patients tell you about, either prior to their treatment program or specifically prior to surgery? So maybe we can address those up front.
Right. I think that's probably a better question for the patient speakers later today, but I do think I think it's just, in the beginning, it's fear of the unknown, and I think it's very personal and specific about what's scary, whether it's surgery, whether it's friends finding out, whether it's being able to follow the plan.
Thank you. And, yes, Honor?
So this is a question for Luke. First of all, great talks, fantastic. Luke, for you, how do patients go about finding orthotists? Obviously, some have very large reputation and they're well known, but I'm the patient sitting here. Help me find out who my best orthotist may be in my area.
I think as the interaction between our organizations, for me, SOSORT and SRS and others, are becoming closer, the physicians, the orthopedic surgeons, you all, and the neurosurgeons out there in the community are becoming aware of your options, and you're becoming aware that we're challenging ourselves to raise the bar and have a higher standard. And so I would say it starts at that local level with you all of saying, hey, let's not just consider all braces to be the same. Is there something different that can be done here in my local community, and can I encourage my orthotist to go get special training? And I let my orthotists understand that they can up the game, so to speak. Our goal isn't to have everybody flying to us from all over the country and the world, but it is to make scoliosis specialists within the orthotic community.
We're taking any questions from the audience, but I have one for Peter. Peter, we know that we found the cause for spinal muscular atrophy. We found blood tests for cancer. What's the cause of idiopathic scoliosis?
You gave me an easy one. Yeah, if it was easy, we would know already, wouldn't we? The fact that we still, for so many years, decades now, have been managing this condition without a clear understanding of exactly what its cause is extremely frustrating. I know for patients who are diagnosed with it, but for providers who provide the care, to not have the cause is really difficult for us. The things that we do know are that there's a genetic component to this, and so I think that gives us some clues as to where we should be looking. But it's not going to be a simple single gene genetic condition where it's just inherited right down the line. I think many of you who have scoliosis some of you will have very close relatives affected, and others you won't even know anybody who in your family who has scoliosis. So this genetic condition is still probably going to be a number of different causes with a common pathway that presents as scoliosis. I tried to give you some sense that delicate mechanical structure of our vertebral column is somewhat unstable, and there are probably a lot of ways to disrupt that stability that eventually presents as scoliosis, whether it's an underlying neurologic problem or muscular problem or connective tissue problem or bone problem, or just a difference in how growth is programmed. I think all of those have some potential to be underlying causes, but it's, I wish we had some more specific answers, and we'll continue to look, I promise you that.
I think that's probably the same answer for Scheuermann's kyphosis as well. You know, when I was starting out in practice, we thought that in the early 90s we'd find the gene for scoliosis, and it still eludes us. But advocate for research, and hopefully we'll find at least some predictive ability to know which ones are going to be the bad cases and which ones are not. And that's at least a reasonable, I think, achievable goal for some time in the foreseeable future. Yes, a question from the back, yes?
Thank you very much. There was, in one of the presentations, and I apologize, I'm not sure which one, there was a slide that showed 13, and I think it was 35 and 75 or something like that, circled, I'm assuming ages, which I'm wondering, are those like the three primary windows that it would present, and are those potentially time frames for the same person or for different people for different reasons?
I think that might have been my slide where there was 100 squares, yeah. And this was just demonstrating that there were 3 out of 100. No specific reference to those specific numbers. We could have picked any 3. It was just trying to demonstrate 3%.
Sorry, I thought it was ages.
But yeah, to pick up on that,
reading more into it than I intended. I apologize.
To pick up on that, though, the most common age really is the preteen time when it comes up, but it can actually develop after in later adulthood when the discs start to degenerate a little bit and things can spin, and you can get some new what's called de novo scoliosis in late middle age, and then it can even happen in young children, 1, 2, and 3 years old. So it can happen at any age, and each one has different characteristics. Is treated by non-surgical or surgical methods. So the infants we can often cast and cure. The adults sometimes get okay with physical therapy and sometimes need surgery. Yes?
Can you talk about girls versus boys and what the percentages are between the two, and if there's if one sibling has it, if there's a higher likelihood that another sibling will have it?
Sure, I guess that probably lands in my talk. The incidence of small curves is equal, at least in the idiopathic variety, is equal in boys and girls. So small curves equally affected in both sexes. But for some reason, girls are much more likely to develop progressive curves than boys. It's about 8 to 1 that girls will have larger curves compared to boys. So that doesn't mean boys are immune from this, but girls are certainly much more likely in idiopathic form to develop a large curve, which is why curvy girls is largely curvy girls and not curves be girls and boys. But there are some boys and curvy girls too. So, but we do see that is very common in the idiopathic variety. In some of the other forms of scoliosis, there is no real predilection for one sex or the other. But in this idiopathic form, we don't know why. Your other question of if you have an affected child, is a sibling or near or close relative more likely to be affected? And in the idiopathic variety, that is the case. But it's clearly not the fact that if you have one child affected, all others will be, or it's not like that. There is an increased risk if you've got the genes that allow one child to be affected are likely the same genes that will allow another child to potentially be affected. But again, it's not a one-to-one correlation at all, but there is increased risk.
Question in the back.
Thank you, everybody, for this excellent presentations. Can you talk about the role of diet, exercise, and sleep, and how those things, nutrients, and all, vitamins and all that can help?
Yeah, that's a very good question. A lot of people ask that, and I think the best person to answer that would be Dr. Josh Pahys.
Because I'm tall. I got the most. There is a lot of research out there, and some good and some not as critical. I try to counsel my patients that we haven't found anything yet that is objectively that's able to manage scoliosis better than the brace. But there's a lot of other things you can do. So I advise all my patients to lead a healthy life, be active, eat a healthy diet, but just because that's good practice for everybody. Should I get into swimming or should I get into yoga just because of my curve? I think you should do it if that's something you like to do. I try to caution my patients and families against doing things because they feel like they have to. Because I think, the last speaker put it very well, like, don't let scoliosis run your life. I think enjoy life. This is a part of your life, but shouldn't run your life. So do things because you want to be active, because they're enjoyable for you, but not necessarily because you feel like you have to. Because there hasn't been any specific things out there that have truly been proven on a consistent basis to really affect the prognosis. So I think maintain an active, healthy lifestyle, good diet, and just enjoy life.
And there's some evidence from Asia that vitamin D and calcium status and bone density can affect the success, especially of maintaining smaller curves. Now, vitamin D is controversial, but there seems to be at least some moderate level evidence for that. So we'd like diet to be a part of it, but we have to be honest about the evidence. Michelle, did you have?
I have a question right here.
Yes, question please.
Hi, so I have a special friend. She's 11. She has CP and she's wheelchair bound, and she was just diagnosed with scoliosis. So I just want to know if there's anything advice I can give her parents, because they are hesitant about having her have the surgery because she's already very hard to lift. So I just want to know if there's anything I can recommend for them.
Did you say she has CP?
Yes.
Okay, so CP stands for cerebral palsy, which comes in all shapes. Some people can walk and some people can't walk. We have a physical therapist here, Rebecca Leonard, who's kind of an expert in that, and we will discuss that in more detail in one of the breakout sessions. But just to say, in some moderate curves, if people are finding trouble sitting up well in their chair, bracing can have a value, but it shouldn't be pushed if it's a problem. And this is a prolonged discussion to have about that, but I will say there's a limited role for bracing, but it has to be specifically targeted to the individual patient. So we can actually pick that up in the next session, which is early onset and neuromuscular. So thank you for that perfect lead-in, because we have reached the time for this general session, and we're going to break up into 3 rooms. It's Peter, Paul, and Barry. So Peter is going to take care of the idiopathic scoliosis here, and then I will be next door with the other group that'll be talking about early onset scoliosis and neuromuscular scoliosis, to your question. And then right down the hall, we will talk about Scheuermann's kyphosis, led by Baron Lahner. And again, the first hour is information from us to you, and the second hour is more of a group discussion. So take a moment to grab a bagel and some coffee, and then break up into your individual rooms. Anything else, Michelle?